Hey everybody, so this video is going to be kind of outlining the steps of what happens when you get diagnosed with testicular cancer. So first and foremost, you should be checking yourself. If you are a person questioning whether or not you have testicular cancer, there's resources on how to do self-checks, but also you should be going and having a regular physical. If you are a grown man, I've seen people have this even outside the age range. 18 to 35 is the most common landing zone for people that end up with this disease. However, you should be getting yourself checked as a man. The same way at one point or another in our lives, you'll be getting prostate exams, stuff like that. But the right thing to do is to be getting checked. For me, I mentioned I was in jiu-jitsu. I ended up getting kneed slightly, and it caused me to end up checking myself and noticing that my testicle was hard as a rock, which it appears that is a sign of testicular cancer. Sometimes apparently it feels like a little lump, like a pea-sized lump, but early detection is incredibly important. And I'll go through that in another video, but the earlier that you find this, the less there's a good chance that your journey is a little shorter than mine. The earlier you catch it, the less likely it is to spread, the less likely that chemotherapy or surgeries are essentially going to be what you have to do to fight this. That being said, the process starts checking yourself, and then if you have any concerns, you go to a medical professional, a urologist. The urologist is the type of doctor that they deal with all the functions of, my understanding, your kidneys, your bladder, things like that, your testicles. You go to a urologist and you ask them to check, and typically they'll do what's called an ultrasound, where they will basically do, it's the same thing that they do for pregnant women, if you've seen that, on their stomach, to go and look at the baby that's in there and, you know, it waves or whatever it's doing. But you get your ultrasound. The ultrasound will either indicate that there's some form of a mass there or not, in which the doctor will likely take blood. You know, I mentioned it in my first video, that they'll test for three things in your blood. A thing called AFP, BHCG, and LDH. They're called tumor markers. So these markers are indicators of testicular cancer. They're proteins that basically cancer produces in your bloodstream that indicate that something's wrong. So AFP, alpha fetoprotein, beta HCG, which is the pregnancy hormone. From my understanding too, if you have testicular cancer and you have high beta HCG, if you pee on a pregnancy test, it will apparently come up that you are pregnant, and you're not, you are a man. And then LDH, which is less of an indicator. I believe that it has something to do with dead cells in your body or something like that. But the ranges for these things, and I'm not a doctor, this is just, I'm pretty sure my understanding. So AFP, from what I've seen from my doctor for what they measure for the average level, is 0 to 8.8. Beta HCG is it's 0 to 3 is the normal range. And then LDH, I believe it's somewhere in the mid hundreds. I don't know off the top of my head. Probably could have came into this video with that, but like I said, your doctor will tell you if they're high. AFP for me was 125 on my first blood work. My beta HCG was, I believe, 65, and my LDH was about 400. I think it's measured, actually don't remember the actual quantity that they're measured in, but just for regular looking like that, understanding it in the simplest way for the person viewing, that's what it says. After that, you'll be directed to have to get a surgery called an orchiectomy, which an orchiectomy is essentially the biopsy of a testicle, because they can't do 5-point. My understanding of it is that they can't do 5-point biopsies of testicles because something to do with the potential of spreading a disease or bleeding and things like that. I might be wrong on that one, but I know that they don't. I was told that they don't. I haven't heard of anybody getting a biopsy of the testicle. Like I said, could be totally wrong. Could be a doctor out there that does it. But the next step is typically the orchiectomy. After the orchiectomy, at that surgery, well, I'll describe the orchiectomy for you. So essentially the orchiectomy, they remove your testicle. The surgery is not the worst thing in the world. It is a very quick procedure. The surgery itself is about half an hour to an hour and a half. Basically what they do, the doctors will make an incision not in your ball sack. They'll do it kind of up, just about a little south of your belly button on whichever side the testicle they're going to remove it is. So on my left side, it's above my crotch, on my left. Then they go in up there, and that's how they remove the testicle. And then the next step from there is they biopsy it. One more thing I'll say about the orchiectomy is recovery is not bad. You wake up and it's outpatient, and you leave the same day, or typically you do. You go in there, they give you, you go through the whole rundown. You walk into the operating room, which I think for me was the worst part, just seeing the operating room itself. Then they give you anesthesia, and then you wake up in the recovery room, having had a really good nap and missing one of your boys. After that happens, now they have to biopsy the testicle. So this could take it could be quick, could be a couple weeks, depends on your provider. After they biopsy it, they give you a pathology to tell you what type of cancer it is. So there is a few different types of testicular cancer. There's seminoma, which is slow spreading, and then there's non-seminoma, which is aggressive and spreads quickly. But non-seminoma reacts very well to chemotherapy. There is a type of cell called a germ cell, or mixed germ cell. A germ cell tumor is the type that I guess originates from, and again, I'm not a doctor, don't claim to be. This is not medical advice, but it's my understanding of it. Germ cells, basically they originate from things from birth. So basically there's embryonal carcinoma, which is the more aggressive kind, but it moves quickly, but it reacts very well to chemo. There's yolk sac, which I haven't heard a lot about yolk sac, but seminoma. And then there's teratoma, which is resistant to chemo, but it is slow spreading. So if you have teratoma, that doesn't react very well to chemo. It doesn't react at all, from my understanding. So after they do the biopsy, they're going to make a determination as to what happens next, and that's usually followed by a CT scan if you didn't do it before the orchiectomy. So the CT scan will go and show whether or not it has spread to the lymph nodes, or to organs or anything far apart, to see the extent of the disease. So once you determine that, they determine next steps. So if you have, so there's two different avenues that they can go down depending on, well, there's a few. If it hasn't spread and your tumor markers all go back to normal post-surgery, they give you the option of, you can go on surveillance. You can do a round of chemotherapy. They might recommend it just to make sure that nothing microscopically has escaped the testicle and gone to the lymph nodes. It just hasn't grown yet. It's kind of a reassurance thing. Or a surgery called the retroperitoneal node dissection, or the RPLND, which is a surgery where surgeons will go in through your abdomen and they'll remove all of the testicles. They'll remove all the lymph nodes. You don't have more than 2 testicles. They'll remove all the lymph nodes in your abdomen, and then essentially biopsy those to make sure that they don't have any disease, but also at the same time to go and prevent any potential future spread. And they'll typically only do this if your tumor markers stop rising post orchiectomy. Now, in my situation, I already had 2 lymph nodes before on my CT scan that showed that the cancer had already spread, and so that meant that I would need more. I would likely need chemo. My tumor markers were also still rising back up. Typically, the blood work, they'll wait a couple of weeks post orchiectomy to just make sure that it's not rising before they make a decision. Now for staging. So staging for testicular cancer is based on, there's stages only 1, 2, and 3. There's no stage 4 testicular cancer, but these things have A and B's to it. So it's stage 1A, stage 1B, stage 2A, 2B, stage 3A, B, and C. And these are based on where the cancer is and your tumor markers. So 3C is elevated tumor markers with lymph node involvement that's spread to distant organs. So 3C, for example, could you have high tumor markers and it's spread to your lungs. 2A is low tumor markers spread to lymph nodes, stuff like that. So from there, basically what happens is you have your choices as to what happens next. So for me, in my experience, what happened was while I was waiting post orchiectomy for what happens next, my cancer had continued to spread, and it went from the 2 lymph nodes to several lymph nodes, as well as to nodules in my lungs. Now, I didn't see, now I had, the only side effect I really had was I was fatigued. Some people get night sweats, and basically, and I'll get into a whole thing on things to look out for actual detection in a different video, but just before the surgery, I had severe lower back pain leading up to the surgery that had progressed from when I got the initial orchiectomy to when I actually started chemo. And at the point when I started chemo, after my first week, my back pain went away. It shrunk down the tumors that were there, and they're very small. Essentially, the tumors are measured in centimeters. They're very small for the most part. I got lucky. I didn't have anything that was golf ball sized or things like that were sitting in there. So I got lucky in that capacity. Obviously, I'm not lucky. I'm going through chemo right now. So what happens, so then if you decide to go and do chemo, there's 2 different types of chemo that they'll decide on, and either at the outset. So there is, they call them by letters. So there's EP, which stands for etoposide and cisplatin. Those are 2 chemo drugs that they'll give you during the course of treatment. And then there's BEP, which is the same 2 that I just said, plus a much stronger chemo drug called bleomycin. And so bleomycin has, it's been said that it could cause lung toxicity, lung fibrosis, kind of could cause lung damage, as well as some other things. The other 2 also have their own side effects accompanied with it. I'll do another video on the side effects of chemo. But basically, as you're going through it, you'll have a choice of one of these 2 depending on what it is, or they might tell you if you have aggressive disease or you're in poor prognosis, and it goes by good risk, intermediate risk, poor risk for survival for reoccurrence for the disease based on the spread, the tumor markers, etc. And these resources you could find easily online as well. But they might tell you that you have to do 4 rounds of bleomycin. And the way that actually works, I'll do in another video. To be more specific, I don't want to cut anything out. I'm just giving you guys kind of the outline of the journey here. So then once I finish, so I am now in the eve of my 3rd cycle, so I have 2 left. And it has not been the easiest road at all. It sucks. This whole experience sucks. Not gonna lie, but you gotta find the good moments in there. But after I'm done with chemo, it's gonna be a couple of weeks, and then they're gonna do CT scans after to see and make sure that the chemotherapy killed everything and that there's no more cancer left in my body. If there is still residual masses, they could be chemo-resistant teratoma, the slow spreading thing, which may have gone through the testicle. It could be chemo-resistant germ cell tumor, or it could be scar tissue. And there's not really any way to know without doing the surgery. So typically the way that it works is that if there's any lymph nodes that are over a centimeter at the end of chemotherapy, they'll recommend you to do the lymph node dissection surgery. That surgery, they go from here to here, cut you open, and they go inside and remove the lymph nodes. Now at that point, they'll go from there to determining what would happen next. So typically it sounds like, from the experience I've seen from most people, if you have to do that surgery, it's usually about it. Or some people end up in a situation where they have to do high-dose chemotherapy, which they'll have to do another regimen of something higher. I'm not there yet, so I can't give you a lot of insight on that. Knock on wood, I don't want to be there. I'm hoping that my chemo wipes this thing out and I can put up a video in the end of October telling you all that I'm in remission. So I'm praying on that. I'll make another video on more of the specifics of chemo, what to expect, side effects, and other options of what you can do. But that's basically the timeline for testicular cancer, from finding out to staging to orchiectomy to deciding on doing chemo to doing chemo to post chemo. And yeah, that's pretty much that video. So I'll be making another one on actual chemotherapy and what's about, what to expect, and side effects. Lump them all into one video, so it's not complicated. But that's pretty much what I want to do for this one. Thank you.